Welcome to HITshow, your go-to source for today's leading healthcare business headlines. I'm your host, RHONDA Brooks. It's Monday, September 22nd. On today's HITshow, Sutter Health and Epic connect the EHR to the home. CVS Health steps up its fight against hospital readmissions, and Premier moves to go private in a multi-billion-dollar deal. Plus, UPMC is in talks to expand its footprint into Ohio, and we'll check in on what Congress may do next with telehealth and ACA subsidies. And we'll wrap up today's show with Teresa Vaughn taking us inside Advocate's new AirCAD training center in Charlotte. Let's get started. We begin with innovation. Sutter Health and Epic are working together to connect home devices directly into the EHR, a first-of-its-kind step for chronic care. Nate Collier has the story.
RHONDA, this isn't just about plugging in gadgets. It's about building a continuous loop of data between the patient at home and the clinician in the clinic. Patients with diabetes, COPD, or heart failure will use connected devices like glucose meters, scales, and blood pressure cuffs. Those readings flow automatically into Epic, triggering alerts and care pathways when something's off. This means doctors and nurses can see patterns over time, not just snapshots from office visits. For example, a steady climb in blood pressure could trigger outreach days before it turns into a hospital admission.
So it's not just convenience, it's a real-time safety net.
That's right, RHONDA. The program is designed to reduce emergency visits, lower costs, and give clinicians the confidence that they aren't missing red flags in between appointments.
This seems like something the industry has been working toward for several years. We'll be watching closely for clinician feedback and patient experience reports. Thanks, Nate. Next, CVS Health is expanding a program to cut hospital readmissions for Medicare members. Peter Betterworth has more. Hey, Peter, what's the scoop?
RHONDA, CVS Health is embedding Aetna nurses into hospitals to help manage patients as they leave the inpatient setting. The idea is to guide members through that vulnerable window after discharge, when complications and confusion often send them right back to the ER. The company's own data shows early pilots cut 30-day readmissions by double digits, and executives say it's about making discharge safer. Dr. Ben Kornitzer, Aetna's chief medical officer, said, "Hospital discharge is one of the most important and vulnerable moments in a patient's journey. By embedding Aetna nurses within hospitals, we're partnering with care teams to ensure that members are supported every step of the way and have the right services to stay well and avoid complications."
That really underscores the stakes. For hospitals, fewer readmissions mean better quality scores and stronger financial performance in bundled or value-based contracts. It sounds like it would create an overall better patient experience.
It's a payer program, but hospitals are very much part of the equation.
Thank you, Peter. When we come back, the market heats up. Premier makes a $2.6 billion move to go private, and UPMC enters talks to expand across state lines. Plus, later in the show, we'll visit Charlotte for the opening of the first AirCAD surgical training hub in North America. Stay tuned.
HITshow is made possible by Altera Digital Health's Sunrise EHR, the flexible solution that provides tools and technology clinicians need to deliver better care their way. And with AI integration, Altera is leading with heart, bringing the human side of healthcare even closer.
And we are back with finance news. Premier is going private in a $2.6 billion deal. Logan Stokes joins us. Logan, what's behind this decision?
RHONDA, Premier has faced headwinds. Hospitals under pressure, margins thin, and slower growth in its group purchasing business. Patient Square Capital is taking the company private to give it more flexibility. CEO Michael Alkier said it directly as the healthcare landscape continues to rapidly evolve. Transitioning to private ownership will once again enhance the company's financial flexibility. For hospitals, the real questions are how this affects GPO contracting leverage and whether Premier can now accelerate its analytics and population health tools.
So in short, it's less about Wall Street, more about strategic breathing room. Thanks, Logan. And Logan, you're also following another big market move. This one spans state lines from Pennsylvania to Ohio.
That's right, Rhonda. The University of Pittsburgh Medical Center is in talks to acquire 3 hospitals in Steubenville from Trinity Health System. If the deal goes through, it would extend UPMC's reach deeper into Ohio. Negotiations are ongoing, but the implications are clear. This would shift competitive dynamics in the region, possibly altering referral patterns and payer negotiations. Integration, if approved, will mean EHR alignment, staffing decisions, and cultural change.
So this isn't done yet, but the writing's on the wall. If UPMC succeeds, it reinforces a trend we've been watching: big systems crossing state lines to build regional dominance. Thanks, Logan. On Capitol Hill, the fiscal fight is heating up. Anika Shah has the latest.
Thanks, Rhonda. The House advanced a stopgap bill that would keep the government open through November. The key for hospitals is it extends Medicare's telehealth flexibilities and the hospital at home waiver. But negotiations in the Senate may change the details, and ACA subsidies are in the mix too. Some Republicans want cuts, others want extensions, all with serious payer mix consequences for hospitals.
So providers have temporary relief, but the uncertainty keeps growing.
Exactly. What happens in the next few weeks will shape 2026 budgets and beyond.
Thank you, Anika. Hey, Teresa, we heard there was some excitement at the Pearl Innovation District in Charlotte at the end of last week. What was happening?
Well, RHONDA, Advocate Health opened the first ever IRCAD in North America. Dr. Rasu Shrestha, Executive Vice President, Chief Innovation and Commercialization Officer with Advocate, is joining us now. So, Dr. Shrestha, what is an IRCAD, and how does it benefit the healthcare ecosystem?
So if you're a surgeon, so if surgery is your religion, then IRCAD is your mecca. IRCAD is where you go to get trained in minimally invasive surgery, to get trained in experiential learning, surgical simulation, and training in robotics and AI. So that really has become now a destination center for surgeons globally. And I could not be more excited, and I'm looking forward to continuing to push the trajectory of innovation forward through this, what is now a global destination center right here in the heart of Charlotte.
That sounds like a big deal. Why Charlotte? And why now?
Earlier, Dr. Shrestha told me it's all about building a super magnet at the Pearl, Charlotte's new healthcare innovation district. After years of negotiation and planning, Advocate Health is launching the first ever IRCAD in North America.
IRCAD North America really stands as a beacon of innovation in North America. It's a place where surgeons and scientists and engineers and investors and healthcare leaders from across the globe will really come together to push the boundaries of what's possible in medicine.
And it sounds like industry partners are already lining up.
Titans including Siemens, Stryker, Medtronic, Johnson & Johnson, and Boston Scientific, with new partners like Pentax and Proximie also joining. Over the next year, Advocate expects 8,000 physicians to train in Charlotte. Dr. Shrestha, what's one message you want other hospital administrators across the country to remember?
The opportunity to really all of us gravitate in this ecosystem that is IRCAD North America could not be more immense, and I'd welcome you to come visit us.
Wow. That's a bold new chapter for Charlotte and for U.S. medical training.
Teresa, thank you so much for your time, and I look forward to chatting again soon.
Teresa, we should take him up on his offer and make a personal visit.
Absolutely. Sounds good to me, Rhonda.
That's all the time we have for today. Thank you for joining us on HITshow. If you liked these stories, please follow us on LinkedIn and check out our in-depth feature videos on HIT.show. HITshow, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. HITshow is made possible by Kimchi. Transform your team with an agentic AI workforce that creates, optimizes, and distributes marketing content while keeping the human touch. For an AI workforce powered by you, Kimchi.com.